Americans last year died at a higher rate. The most striking cause, an epidemic of prescription drug abuse that now accounts for more fatalities than illegal drugs.
It's important to recognize that today we are seeing more people killed because of opioid overdose than traffic accidents. Now you think about that.
The rate for suicide, another leading cause of death, also grew, continuing a trend especially among middle-aged men.
In fact, over the last decade, the rate of suicide for that part of our population went up the most. It went up almost 30%.
Meanwhile, heart disease claimed a higher share of the population than the previous year, reversing slow progress in fighting the nation's top killer. Another leading cause of death, dementia and Alzheimer's disease, has become more common as life expectancy among Americans keeps rising, although not as rapidly as in Western Europe and Japan. But the decline in cancer, strokes, and accident death rates held steady. The latest government figures don't break down the fatality trends by demographic group, but Nobel Prize-winning economist Angus Deaton recently reached one significant conclusion. Deaton found that over the past decade or so, white Americans aged 45 to 54 died at a higher rate, even as the rates among every other age, racial, and ethnic group were on the decline. That same study concluding that middle-aged whites are also reporting themselves suffering from more mental health problems and difficulties finding and keeping a job. Tom Ackerman, Al Jazeera, Washington.